UC Davis offers a unique opportunity for fulfilling all the three missions that we have in academic medicine. From training, education, research, clinical care, and community outreach.
There's plenty of opportunities in terms of procedures, various pathologies. We have a lot of research opportunities now as well. Depending on what you're interested in, it can easily check any of those boxes.
We provide clinical care to a large area of Northern California, from the Sacramento metropolitan region all the way to the Nevada border.
From Central Valley, including Bakersfield, all the way to the border with Oregon.
So it's a very large geographic area that includes both urban populations as well as rural communities.
Sacramento is a pretty diverse area, so we have a lot of different ethnicities here. For people that value diversity, it's a very good place to train.
We cover all the areas of gastroenterology,
including inflammatory bowel disease, liver diseases, motility disorders, providing both expertise in these disease areas, procedures, as well as access to clinical trials.
First one is difficulty swallowing. The second one, programmed for gas.
In the area of motility, there are only 3 available centers in the Northern California area, and we're one of them.
It'd be unusual for it to be that recurrent liver cancer that you had before.
We have a large group of faculty members with a focus in the clinical practice of hepatology or liver disease. That includes expertise in autoimmune liver diseases, rare diseases such as Wilson's disease, fatty liver disease, and advanced cirrhosis.
The most up-to-date technology allows us to assess and treat patients with difficult conditions that do not have that access in the community. We are truly a tertiary care center.
Was the medicine called nortriptyline?
Yeah, that's what it was called.
Okay, so you tried taking that for a little
UC
while.
Davis is one of the pioneers of telemedicine in the United States. A patient in a distant or rural area will have access to the knowledge of a doctor caring for patients in a tertiary care center.
Being trained in that area of telemedicine is incredibly important, particularly now and into the future.
And you can always schedule an earlier visit. You know, it's very easy when it's over the phone or via video visit.
We are a very comprehensive group. We're strong in knowledge, manpower, and we have amazing group of staff, of nurses, technicians, all working really hard to do the best we can for our community.
All of our faculty here at UC Davis love to be involved in trainee education. That's why most of us are here.
I worked with them a lot as a resident in clinics, doing research on the rotations, and I really, really enjoyed it, and it's a big reason why I stayed.
How's your belly doing?
It's doing all right.
Yeah, can I just get in here?
Yeah.
We enjoy working with our fellows and seeing them grow and flourish as they acquire these new skills.
Push in just a little bit, rotate so you can see. This is the hiatal hernia, right? See the pinch there? We really produced excellent clinicians here, which was one of my main goals when I was a fellow. But we also really value the happiness of the fellow. We want the fellows to enjoy their experience while they're learning. We accept 3 fellows per year, but the design of the fellowship is slightly different. The first 2 years are much like what you'd experience elsewhere, with a lot of primary GI, hepatology, research. The 3rd year, we do have a greater emphasis on advanced endoscopy and ERCP, where fellows can get some experience with advanced procedures.
Okay, that's good. Okay, I'll hold it here.
Pull back a little bit more.
In general, I think they get a lot more hands-on experience with that than they do in other programs.
There you go. Very
Perfect.
good. Very good.
Perfect.
I've spoken with a lot of fellows who have graduated from the program over the last couple of years. They've all felt really prepared to practice in the clinical setting after fellowship.
Our fellows are exceptionally well-trained gastroenterologists when they leave here.
Slowly, slowly, feel it as you do it.
From my year, there were 3 in my class. 1 person went into private practice, and myself and my other co-fellow both stayed at UC Davis and are here still today. So we do create clinicians who have academic careers.
It really stands out to you that people who are working so hard every day in their training are still able to really relax and have fun.
The reason that some of our fellows choose to stay at UC Davis, the collegiality we have here is really strong. It's almost like a family here where you get to know every attending on a personal level, and you enjoy their interactions so much that why take the risk of leaving when you know you love it here. The splenic flexure, hepatic flexure, cecum, and then through the IC valve into the ileum. Perfect. All right.
UC Davis is a highly ranked research institution in the top 40 of NIH funding. And within the Division of Gastroenterology, we have several NIH-funded investigators, as well as very busy clinical trials.
We are leader in conducting cutting-edge research, basic research and translational research, as well as clinical research, with the intent to identify new diagnostic and treatment options for patients with liver and GI conditions. It's a basic of the academic world and our academic environment. So for fellows and trainees, it gives a possibility to learn, receive mentoring, expand their opportunities, to establish collaborations, to start their careers.
Lifestyle is a big attraction for people coming to UC Davis.
Sacramento is an amazing place to live.
We have exceptional arts, exceptional coffee, which is really important for our fellows.
Any outdoor activity you might want to do is available here, and the weather's spectacular to enjoy it in.
So it's good for family people, young people, people who like to get outdoors. I think a lot of people can really be happy here.
It's a great place to live and to work. I saw this place, along with Dr. Bolus and other doctors, go from a very small group to a group that now makes a list of national reviews of the best medical centers in the United States. So I think that we should all as a group be so proud.
You ready to go home?
Yes, sir.
And it's not just the buildings, which are state-of-the-art and world-class. It's really the people.
We have a very low turnover in the faculty. And most of the people that we have been able to hire over the past 20 years have stayed for the extent of their career.
See, now you're in. Oh, look, and you're in Delia. Look at that, perfect. You see the people interacting all around you, and you can just tell that people are enjoying their jobs here.
I love my job. I feel privileged to come and work with an exceptional group of people every day.